I'm here to talk to you for a few minutes about my article entitled Turning Physicians into Heartwood. I'm a family physician and a research fellow at the Allina Health Division of Applied Research in Minneapolis, Minnesota. Heartwood is a concept that comes from an author, Spike Carlson, who was writing about trees. And specifically, he was talking about how aging cells in trees slowly lose their ability to conduct water and nutrients and become hardened. The hardening of these tree cells becomes the core of the tree and functionally acts as structural support. He asks the question, can humans learn something from trees? And that's what I think I'd like to talk about. Can we as healthcare organizations learn something from trees and figure out how to turn physicians into Heartwood? Specifically, the question at hand is, how can we leverage the knowledge, wisdom, and experience of senior physicians at a time in their career when they're struggling with the pace, demands, and changes in healthcare? Can we use this knowledge, can we use this experience to mentor, to role model, and perhaps even add back to the organization by doing such things as community engagement and more structured relationships with younger physicians? I'd suggest that we need to consider diminishing the amount of patient care time that physicians are requiring, and in turn replace that with these additional duties. All of the new healthcare system redesign initiatives are focusing on primary care providers as a major access point for the healthcare. Unfortunately, over the last decade, there's been a decreasing number of medical students entering primary care specialties and an increasing number of aging primary care physicians retiring. A 2014 Physicians Foundation study found that 44% of physicians would plan on decreasing the amount of patient access within the next year, and 39% of the physicians are going to accelerate their retirement planning. Using the senior physicians in an altered Heartwood way may help to alleviate some of that transition time as we create strategies to increase the number of primary care physicians entering the healthcare workforce. A great deal of healthcare system redesign is focused on innovative practices and such things as workflow processes, payment reform, value proposition. I would suggest that another form of innovation is investing in the people who are responsible for helping with both patient care and the implementation of these other new healthcare system design strategies. The Heartwood model is an opportunity to leverage the experience and wisdom of the senior physicians and take advantage of this in such a way that they can offer mentoring and role modeling practices to the younger physicians, even as they contribute to the community at large. Innovation in healthcare is often focused on programs and policies, funding. Innovating in the people is another way to look at future healthcare system redesign.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.